Hello, everyone. I'm Dr. Emily Hart, and today we need to talk about something that's hiding in plain sight in millions of medicine cabinets across America. It's a class of medications that many people take every single day without realizing the damage they might be doing to their brains. We're talking about anticholinergic drugs, and the science linking them to memory loss and dementia is absolutely alarming. Now, before you think this doesn't apply to you, let me tell you something that might shock you. These medications aren't just prescription drugs for serious conditions. We're talking about common over-the-counter sleep aids, allergy medications, drugs for overactive bladder, antidepressants, and even some pain relievers. Chances are you or someone you love is taking at least one of these medications right now. Let me start by explaining what anticholinergic means, because understanding this is crucial. Your brain relies on a chemical messenger called acetylcholine. This neurotransmitter is absolutely essential for learning, memory, attention, and overall cognitive function. It's like the communication system that allows your brain cells to talk to each other effectively. Anticholinergic drugs block this neurotransmitter. They literally interfere with your brain's ability to communicate with itself. Now, why would doctors prescribe medications that do this? Well, acetylcholine doesn't just work in your brain. It also affects your body in various ways, causing things like increased saliva production, muscle contractions, and bladder activity. So when you have conditions like allergies, insomnia, or an overactive bladder, blocking acetylcholine can provide relief from those symptoms. The problem is, these drugs don't just block acetylcholine where you want them to. They block it everywhere, including your brain. Here's where it gets really concerning. For years, doctors and patients noticed that people taking these medications often experienced what we call acute cognitive impairment. We're talking about confusion, difficulty concentrating, memory problems, and in elderly patients, sometimes even delirium. We always thought these effects were temporary. Take away the medication and the brain bounces back. Right? Wrong. Recent research has completely changed our understanding of these drugs. Multiple large-scale studies have now shown that long-term use of anticholinergic medications is associated with an increased risk of dementia and Alzheimer's disease. And we're not talking about a small increase. Some studies have found that people taking strong anticholinergics for 3 years or more have up to a 50% increased risk of developing dementia. One of the most significant studies was published in the Journal of the American Medical Association, Internal Medicine. Researchers followed over 3,000 people aged 65 and older for more than 7 years. What they found was deeply troubling. Those who used strong anticholinergic drugs had a significantly higher risk of developing dementia compared to those who didn't use these medications. And here's the kicker. The risk. Another study from the University of Washington looked at medical records of thousands of adults over several years. They calculated what's called the total standardized daily dose of anticholinergic drugs each person took. The results were stark. People with the highest level of exposure had a 63% increased risk of dementia compared to those with no exposure. 63%. Let that sink in. What's even more concerning is that these effects appear to be permanent. Even after people stopped taking these medications, their increased risk of dementia remained. This suggests that anticholinergic drugs may be causing lasting damage to the brain, not just temporary impairment. So what are these medications? Let me give you some specific names because this is information everyone needs to know. First, we have antihistamines. I'm talking about diphenhydramine, which is the active ingredient in Benadryl, and many over-the-counter sleep aids like Tylenol PM and Advil PM. Millions of Americans take these medications regularly for allergies or to help them sleep. having no idea they're putting their brain health at risk. Then we have medications for overactive bladder, drugs like oxybutynin and tolterodine. These are among the strongest anticholinergics out there, and they're widely prescribed, especially to older adults. There are also tricyclic antidepressants like amitriptyline and doxepin. While newer antidepressants have largely replaced these, they're still prescribed fairly commonly, especially for chronic pain and insomnia. Certain medications for Parkinson's disease have strong anticholinergic properties. Some antipsychotics, particularly older ones, are anticholinergic. Even some medications for nausea and muscle relaxants fall into this category. The list goes on and on. Now you might be wondering, how exactly do these drugs damage the brain? The mechanisms are complex, but let me break it down for you. First, by blocking acetylcholine, these drugs interfere with the formation of new memories and the retrieval of existing ones. Acetylcholine is crucial for the hippocampus, which is the memory center of your brain. Without adequate acetylcholine, your hippocampus simply can't function properly. But it goes deeper than that. Research suggests that chronic anticholinergic use may actually lead to brain atrophy. Brain imaging studies have shown that people taking these medications have smaller brain volumes, particularly in regions critical for memory and cognition. We're talking about actual physical shrinkage of brain tissue. There's also evidence that anticholinergic drugs may increase the accumulation of amyloid plaques in the brain. These are the same protein clumps that are a hallmark increased with cumulative exposure. The more of these drugs you took, and the longer you took them, the higher your risk. Additionally, blocking acetylcholine affects the brain's ability to clear out toxins and waste products. Your brain has a cleaning system that operates while you sleep, and acetylcholine plays a role in this process. When you interfere with it, toxic proteins may build up over time, contributing to neurodegeneration. Now, I want to be clear about something. Not everyone who takes these medications will develop dementia. Risk factors for dementia are complex and include genetics, lifestyle, other health conditions, and many other factors. But why add to your risk if you don't have to? The most vulnerable population is older adults. If you're over 65, your brain is already more susceptible to the effects of these drugs. Age-related changes in how your body processes medications mean that anticholinergics stay in your system longer and have more pronounced effects. Plus, older adults often take multiple medications, and the anticholinergic effects can add up. Let me share something that happens all too often in clinical practice. An older patient comes in complaining of memory problems. Their family is worried about dementia. A thorough evaluation is done, and guess what we find? They're taking 3 or 4 different medications, each with anticholinergic properties. Nobody realized these drugs were the problem because each doctor prescribed just one medication, not knowing about the others. We call this anticholinergic burden, and it's a major issue. So what should you do if you're taking one of these medications? First, do not stop any prescription medication without talking to your doctor. Suddenly stopping some of these drugs can be dangerous. But you absolutely should have a conversation with your healthcare provider about your medications. Ask specific questions. Is this medication anticholinergic? Do I really need it, or are there alternatives? If you're taking an over-the-counter sleep aid or allergy medication regularly, this is definitely something to reconsider. For sleep, there are much better options. Good sleep hygiene, cognitive behavioral therapy for insomnia, and even melatonin are safer alternatives. For allergies, newer antihistamines like cetirizine, loratadine, or fexofenadine have much weaker anticholinergic effects. For prescription medications, there are often alternatives. If you're on an older tricyclic antidepressant, there may be newer options that work just as well without the anticholinergic effects. For overactive bladder, behavioral modifications, pelvic floor exercises, and even nerve stimulation treatments can be effective. There are also medications with fewer anticholinergic properties. Your doctor needs to do what's called a medication review, especially if you're over 65 or have multiple health conditions. Every single medication should be evaluated. Is it still necessary? Is the dose appropriate? Are there safer alternatives? Of Alzheimer's disease. It's like these medications are accelerating the very processes that lead to dementia. There are also tools that can help. Something called the Anticholinergic Cognitive Burden Scale rates medications based on how strongly anticholinergic they are. Your pharmacist can help you understand which of your medications might be problematic. Don't underestimate pharmacists. They're incredibly knowledgeable about drug interactions and side effects. Now, I want to talk about prevention, because protecting your brain health goes beyond just avoiding harmful medications. Your brain needs support, especially as you age. Let's talk about what actually works based on solid scientific evidence. Exercise is probably the single most important thing you can do for your brain. Physical activity increases blood flow to the brain, promotes the growth of new brain cells, and even increases the size of the hippocampus. We're talking about both aerobic exercise and strength training. You don't need to run marathons. Even regular walking makes a significant difference. Diet matters enormously. The Mediterranean diet has been consistently linked to better cognitive health and a reduced risk of dementia. We're talking about lots of vegetables, fruits, whole grains, fish, olive oil, and nuts. This diet is anti-inflammatory and provides nutrients that support brain health. Sleep is absolutely crucial. Poor sleep is associated with increased risk of cognitive decline and dementia. During deep sleep, your brain clears out toxic proteins, including those associated with Alzheimer's. If you're not sleeping well, this cleaning process doesn't happen effectively. And here's the irony. Many people take anticholinergic sleep aids because they can't sleep, but these medications actually interfere with sleep quality and may contribute to the very problem they're trying to solve. Social engagement and mental stimulation are also important. Your brain is like a muscle. Use it or lose it. Learning new things, maintaining social connections, and staying mentally active all help build what's called cognitive reserve. This is essentially your brain's resilience against damage. Managing cardiovascular risk factors is critical too. What's good for your heart is good for your brain. High blood pressure, high cholesterol, diabetes, and smoking all increase your risk of dementia. If you have any of these conditions, managing them effectively is essential for protecting your brain. Let me also mention something that doesn't get talked about enough: the importance of hearing. Hearing loss is now recognized as one of the most significant modifiable risk factors for dementia. If you're having trouble hearing, get it checked and consider hearing aids if recommended. The isolation and reduced stimulation that comes with untreated hearing loss can accelerate cognitive decline. This isn't just about anticholinergics either. Polypharmacy, taking multiple medications, is a huge problem in itself. Now, I know some of you might be thinking, I've been taking these medications for years. Is the damage already done? Am I doomed to develop dementia? The answer is absolutely not. While we can't undo past exposures, you can take steps now to protect your brain going forward. Stopping unnecessary anticholinergic medications, even after years of use, is still beneficial. And implementing the lifestyle factors I mentioned can significantly reduce your overall risk. The brain has remarkable plasticity and resilience. Even in older age, your brain can form new connections and, to some extent, repair damage. It's never too late to make changes that support your cognitive health. I also want to address the broader issue here. Why aren't more people aware of this? Why are these medications still so commonly used and prescribed? Part of the problem is that the research linking anticholinergics to dementia is relatively recent. The medical community is still catching up. There's also the issue of fragmented care. If you see multiple specialists, each might prescribe medications without full knowledge of what else you're taking. Additionally, many of these drugs are available over the counter. People assume that if something is available without a prescription, it must be safe for regular use. That's simply not true. Over-the-counter doesn't mean without risks, especially with long-term use. There's also a broader conversation we need to have about prescribing practices, especially for older adults. Too often, medications are added to address symptoms without enough consideration of non-drug alternatives or the cumulative risks of multiple medications. We need to do better. As individuals, the most important thing you can do is be your own advocate. Be informed about the medications you're taking. Ask questions. Don't assume that because a doctor prescribed something, or because it's been working for you, that it's the best option or that there are no long-term risks. If you have elderly parents or loved ones, help them with medication management. Go to doctor appointments with them. Make sure all their healthcare providers know about all their medications, including over-the-counter drugs and supplements. This is incredibly important. Let me summarize the key takeaways. Anticholinergic medications are a diverse group of drugs that block acetylcholine, a crucial neurotransmitter in the brain. Long-term use of these medications is linked to increased risk of dementia and cognitive decline. The risk increases with the strength of the medication and the duration of use. These effects may be permanent even after stopping the drugs. Common anticholinergic medications include many over-the-counter allergy and sleep aids, drugs for overactive bladder, some antidepressants, and various other prescription medications. Older adults are particularly vulnerable to these effects. You should review your medications with your doctor and pharmacist, asking specifically about anticholinergic properties and safer alternatives. Protecting your brain health requires a comprehensive approach, including regular exercise, a healthy diet, good sleep, social engagement, mental stimulation, and managing cardiovascular risk factors. It's never too late to make changes that support your cognitive health. Your brain is precious. It's who you are, your memories, your personality, your ability to think and connect with the world. Protecting it should be a priority. Don't let a medication that you might not even need put your cognitive future at risk. If you found this information valuable, please share it with others. This is something everyone needs to know about, especially if they have older family members or friends. Knowledge is power, and in this case, it might just help prevent cognitive decline. Thank you so much for watching. I'm Dr. Emily Hart, reminding you to take care of your brain, ask questions about your medications, and never stop advocating for your health. Stay informed, stay healthy, and I'll see you next time.